Welcome to another illuminating episode of Rustle Podcast, where we celebrate voices that spark changes and journeys that redefine leadership. And Today, it's a distinct honor to be in the conversation with the pioneering force in the healthcare and the wellness of landscape, Mr. Harbinder Narula, CEO of Healthcare and Wellbeing at Business World. With an extensive vision that bridges media, innovation, and impact, Mr. Narula has dedicated himself to creating the ecosystem that empower the healthcare industry, not just through reporting and recognition, but through the cultivation of dialogue, policy, and discourse and purposeful partnerships. His leadership has helped shape a narrative and the position healthcare not only as a service, but as shared responsibility and evolving culture. This episode is brought to you by Rustle Group, a youth lead platform dedicated by igniting purpose, empowering ideas, and nurturing future change march. Founder by Mr. Ever Visionary Mr. Rahul Suri, the Russell continues to champion meaningful dialogues across generation. Myself, Abhinav Sharma, as a administrative head of the Russell Group, now I'll be going to initiate and take the your podcast. So heading with the first, we are heading with the first questions with the interview. So let's just start it.
Thank you, Abhinav. Thank you, Rahul. Thank you, both of you, for having me here.
Yeah, thank you, sir. Okay, sir. So heading with the first question, sir. The vision behind the work you have been instrumental in redefining the healthcare sector, in engaged with the through media. What catalyzed your journey into the space, and what continues to fuel your vision today?
So I'll tell you what, I had got into healthcare way back in 2008. I used to work at Google. I was the first business development hire for them in India. And while I was working
Okay.
on my assignment at Google, I had access to a lot of industry reports as to what was happening globally. And one of the things that intrigued me at that point in time was the business of WebMD in the US. And
All right.
and also I was looking at how the technology was making a difference in various domains. And that is when
Okay.
it kind of occurred to me that in India, there was a lot of need for correct information. And internet was just about starting. Google was popular. People had started going on to Google to search for various things, including healthcare. And we for whatever you would search, there would be thousands and thousands of search result pages that existed. But the question
Yes.
there in my mind was that information useful for the person who was searching? And the
Yeah.
answer to that was no, because not because Google was not doing a great job, but just because the information that existed on the internet wasn't coming from the trusted sources. And information that we needed was a very basic information that, can I get to know about the various conditions that my body is impacted with? Second is, if I were to seek help from a doctor, which doctor should I go to? How do I connect with the doctor? So there was the very basic stuff that was there. And so that is when it kind of occurred to my head that, somebody needs to do something around it. And that is when I quit my job at Google and I started, a portal at that point in time, which could facilitate uh, this particular need and bridge the gap. So that is how I got into healthcare. What I
All right.
and it was a long journey. I mean, it had internet wasn't a reality. This piece of technology that we use today wasn't a reality. It was cheaper to go to a doctor than to go search for information online, because internet was expensive. So the project had its ups and downs, but but little during the pandemic and post pandemic, I think it was the best
Yeah.
time for us to start redoing what I had set out to do. So that kind of rekindled
Correct.
my desire to make a difference and start doing what I'd set out to do in 2008. And we've been able to do that because the technology is more conducive. People are online. Not only people are online today, the doctors are online, and everything is just working. where somebody could just uh, stitch all these pieces together and make it useful and usable for the audience. So that's my vision of how to get every player in the healthcare ecosystem to come on a platform where there could be honest, transparent conversations that could be useful for the audience.
Okay, very nice. So that is remarkable. Your journey was very exciting and like full of, I think, ups and downs. But yeah, you have chosen a very, I think it's quite challenging. It could be, it was a very challenging for you as well, like from the past year also.
Absolutely.
So yeah, yeah. Okay. Heading with the second question is that creating space for industry. You often speak about creating space for the healthcare industry. Could you elaborate on what this means to you and how the business world is working to cultivate those ecosystem and of collaboration and innovations?
See, I'll tell you what. Like I said, that there is a need for a ecosystem, a platform that engages with every player in the ecosystem. Because if you look at it, the industry has been working in silos. There is a separate group that works on the medical technology, consumables. There's a group of hospitals, whether it is through industry associations or whether it is through media that is addressing that. Then there's another aspect of B2C where information on various health conditions, etc., from the uh, perspective of a patient is taken care of. But if you look at it, I believe that healthcare has to be treated as a sustainable business. The reason I'm talking
Makes sense,
about
correct.
being a sustainable business is because uh, even if somebody wants to do charity, they will be able to do that until they have the money, right? If the money finishes, then despite wanting to make a difference, they will not be able to make a difference, right? So,
Correct.
so even when a doctor sets up a clinic, he has to take care of the costs that are associated with it to ensure that the practice runs sustainably. He doesn't go out of practice. And second is, there is a need today more than ever to upskill the doctor to uh, kind of use the technology advancements to better the clinic and the facilities available. And that requires some level of investment. So, to ensure that you are always sustainable, there is a need to talk about the business of healthcare. Business in the field of healthcare has traditionally is been seen in a negative connotation. यू नो whenever we
Yes, yes.
heard business, वो कान खड़े हो जाते हैं कि यार हेल्थ केयर बिजनेस तोड़ना है, ये तो सेवा है. But even a hospital that you go to, for them to provide you the services, there is a machine which is required, there's a medicine which is required, there's a skilled doctor that is required, there is a trained nurse and paramedic staff that is required. All this somebody has to pay for it. So ये सब
Obviously. Yes.
efficiency build करने के लिए somebody needs to start creating a platform where all these separate elements that come in together to provide a service can be spoken of. So that is where business world plays a role, where we created this BW Healthcare world, where we are talking about the business of healthcare. So that's how it is.
Okay, sir.
Yeah.
It's very got your point, sir. Staying with the next question, sir. In your unique position where policy, media, and the healthcare converge, how do you see the role of storytelling in influencing the reform and reshaping the public understandings?
See, storytelling is the most crucial role. I
Right.
come from a background where I was working at Google, and when I was, and I've truly believed, because I've been part of the project for launching YouTube in India, where I was a part of the team, and I've been a firm believer in videos. The fact is that, and I had started a project called Health FAQs, which was that a question that a person has for which he comes to Google and searches related to healthcare. we would ask a doctor to record a video and share with us. And the reason
Okay.
was, if I were to give you a piece of paper, an article, or a book on your condition, you are leaving it to two things. One is your interpretation of what you read. Second is your level of understanding. But when you go meet a doctor, when you go sit across the table, and when he speaks with you in a language that you understand, it's easier for you to comprehend. आपको समझ आ जाती है
Correct.
जो चीज लिखी हुई है इतने बड़े बड़े आर्टिकल्स के अंदर, बुक्स के अंदर, वो आपको समझ नहीं आती है, बट कोई समझा दे आपको बात करते हुए तो आप
करेक्ट,
समझ जाएंगे.
ज्यादा इजी हो जाता है आपके लिए वो चीज
So
इंटरप्रेट
that is
करना.
one. That is
Exactly.
one. Second
Okay.
is the way you tell it. Because
Okay.
बहुत सारी information available है. Today we have clutter of information which is available both in terms of books or in terms of internet. But this information overload, one, the user does not know where to get the information which is useful to me, right?
Exactly. There is a lot of platform, and the user does not exactly know that where he have to go and where he can get all the relatable information.
Yes.
Makes sense.
Second is you have to contextualize to me. ठीक है ना?
Yes.
I have to understand what's in it for me. मेरे को हेल्प करेगी या नहीं करेगी, ठीक है ना?
Correct.
मेरे को मेरी जो क्वेश्चन पूछा जा रहा है उसको बताओ, ठीक है ना? So what happens is, if you look at the influencer space today, there are a lot of doctors which are there online, and they are able to share a message and create awareness in a manner that people find it engaging. They are able to
Yes.
comprehend and contextualize to their own life, and
Yes.
then completely believe in it. So storytelling, I think, is a very, very fundamental way of sharing information and creating awareness, and that is the basic purpose of healthcare communications.
All right, sir. Got it, sir. Got your point. Okay. So next question is well-being as a culture. As someone who leads a vertical that goes beyond illness to focus on wellness, how do you interpret holistic well-being, and how can we, as a society, move towards a culture of preventive care?
See, I believe in, there are these four P's that I talk of when it comes to health
Okay.
and the difference that it makes. One is, it begins with predictability. A lot of people talk about preventive, but I think it is predictability that it begins with. If I'm able to predict what could happen to me, then I will take action to be able to prevent it. Right?
Makes sense. Correct.
और मेरे को पता
Correct.
है, फॉर एग्जाम्पल मेरे फादर डायबिटिक थे, मुझे पता है कि अगर मेरे लाइफस्टाइल पे हेरिटेरली आई एम प्रोन टू डायबिटीज, then I could do something to prevent diabetes. Otherwise, I'm oblivious to it, right? So then
All
comes
right.
preventive, right? Now,
Right.
second thing is that today the well-known fact is every body is different. मेरा शरीर किसी और से साथ मैच नहीं करता है, डिफरेंट है. मेरा मेटाबॉलिज्म हो सकता है डिफरेंट हो. सो आई कुड डू पर्सनलाइजेशन, राइट? सो
All
मैं
right.
वो चीज करूंगा जो मेरे लिए काम करेगी. वो चाहे एलोपैथी हो सकती है, नेचुरोपैथी हो सकती है, होम्योपैथी हो सकती है, आयुर्वेदा हो सकता है, कुछ भी हो सकता है.
Right.
देन इज प्रिसिजन. आई मीन, अगर मैं बीमार पड़ गया तो मेरे लिए क्या काम आएगा, तो प्रिसिजन. तो ये चार पीस हैं जो डिफाइन करते हैं हेल्थ केयर. नाउ आपका जो क्वेश्चन है कि होलिस्टिक हेल्थ
Yes.
एक्सट्रीमली इंपॉर्टेंट, बिकॉज मेरा मानना है कि जब तक ट्रीटमेंट हीलिंग में बदलेगा नहीं तो वो असर नहीं करेगा, ठीक है ना?
बात बात है.
सो सो आपका आपका जो ट्रीटमेंट दिया जा रहा है, जो मेडिसिन पॉइंट ऑफ व्यू से है, इट ऑल्सो हैज टू क्रिएट एन इम्पैक्ट ऑन योर मेंटल हेल्थ. इट हैज टू मेक यू फील दैट यू आर अंडर द राइट केयर, under the right treatment, and that will create an acceptance for your body, because your body will start reacting to that. दूसरी चीज ये है कि
Correct.
आने वाले टाइम पे अभी हम क्या है, डिफरेंट मोडालिटीज, डिफरेंट थेरेपीज, डिफरेंट काइंड्स ऑफ मेडिसिन आर फाइटिंग विद ईच अदर. होम्योपैथी सेज कि हमारा बेटर है बिकॉज एलोपैथी के साइड साइड इफेक्ट्स उनसे होते हैं, होम्योपैथी में नहीं है. Ayurveda
हाँ,
talks about lifestyle, right?
हाँ,
But
correct,
अगर आप एक condition देख लो, for example, if you look at conditions like diabetes, you look at conditions like cancer, etc. यहाँ पे तो holistic health ही काम करती है. आपका
correct.
mindfulness होना, which means your mental alertness works. Your Ayurveda lifestyle works because you need to go for your walks. You need to take care of your body. You need to start creating
Correct.
meditation, etc. De-stress yourself, and then you
Yes,
need to
sir.
also take allopathy medicine to keep your sugars under control. So, if you
Correct.
look at it, we are by default looking at creating a holistic and integrated health as a treatment. आने वाले टाइम
Okay.
पे this is what I think is going to work. Each of these hospitals would also turn into integrated health because the objective will be patient centricity and outcome. If you're looking at patient centricity and outcome, then you're saying that whatever works should be done for the patient so that he becomes hale and hearty, right?
Okay. So, like you believe in future that the all the hospital and will approach the integration of Ayurveda and like allopathic
Actually,
and
people have
homeopathic.
already started talking about, apart from the physical treatment, there has to be a mental strength that has to be built. कैंसर पेशेंट है,
Exactly.
वो मेंटली स्ट्रांग नहीं होगा, वो ट्रीटमेंट एक्सेप्ट कर ही नहीं सकता है. ठीक है ना?
Yes, sir.
राइट. डायबिटीज के अंदर इफ यू डू नॉट टेक केयर ऑफ योर लाइफस्टाइल and lead a lifestyle which is also inspired by Ayurveda. So, your medicine will do what it is doing. But if you were to club what medicine does with the lifestyle, you'll be able to better manage your diabetes.
Like you have to like balance out both of the thing, like mentally also and taking the help of the medicine. Not only the medicine will gonna help you alone
Absolutely.
in
So,
the journey of
mental health and
yeah.
physical health have to go in together, and that is what integrated health is going to be.
So the question was same, like many of our listeners are the young students, I have told before, aspiring professional and the change agents. What guidance would you offer to them, particularly to those eager to make meaningful contribution to the healthcare sector?
So, my message to the youngsters, like I was saying, that, we are blessed as a country where we have produced the best of doctors for the world, and we have also produced the best of engineers for the world. So हमारे पास ability तो है हमारे पास. It's not that we are not able, but what we need to work on is the mindset of the youngsters. So there are three things
Correct.
that come into my mind when I talk about healthcare and youngsters. Is one is we need to focus on people, and we need to focus on purpose, and we need to focus on the impact. And why I say that is that people aspect is very, very important. It's not about becoming a doctor. It's about
Correct.
always having the mindset to upskill and update yourself. Technology is changing very, very fast. So if you are someone who
Correct.
thinks that, now I've become a doctor and now I don't need to update myself, or I don't have the time to go upskill myself, then you will be out of the industry. You will not be able to create an impact. Second thing is when I
Good.
spoke about purpose, uh, choose this profession for the right reason, right?
All
Like
right.
we used to talk about entrepreneurs, जब entrepreneur बोलते हैं ना कि हम I want to become an entrepreneur because I want to make a lot of money, or I want to become an entrepreneur because I don't want to work under someone, right?
Yeah, yeah. Nowadays it's going very much. And actually, I think there's a lot of the people who are having a zero knowledge of entrepreneur business are also not stepping in the business world who have a like who have no knowledge just because of the sake of money that they have to like
But
earn
the
money
thing
and
is, देखो, पैसा has to be an outcome. I mean, it's a very cliched thing when people say that, money is an outcome, it's not the purpose. But if you see
yes, sir.
people who have really made money, they have been working constantly on trying to better the things, and money has been chasing them. If you chase the money, it will not come to you, right? But what I'm
Exactly,
talking about
exactly.
is,
Yes,
and जो लोग बोलते हैं कि I want to become an entrepreneur because I don't want to work under anyone. Entrepreneur has multiple bosses, राइट. आपका कस्टमर आपके
correct.
सिर पे चढ़ के बैठता है, आपका वेंडर आपके सिर पे चढ़ के बैठता है, आपके एम्प्लॉयज आपके सिर पे चढ़ के बैठते हैं. ठीक है ना? सो यू इंस्टेड ऑफ हैविंग वन बॉस, नाउ यू हैव मल्टीपल बॉसेस, राइट?
Correct.
So Even a doctor or a medical professional, a healthcare professional needs to choose this profession with a very right intent and right reasons. And if you are
All
successful
right.
making that, fulfilling that reason, money will follow, right? But choose why you want to become a doctor. And the third thing is, which also gives you a reason of why, is the outcome. You know, key, you have
Okay.
to always be focused on creating an outcome. People, the doctor, the patient, and the patient's family is expecting an outcome of what you do with the patient, right? So these are the three
Right.
things that I feel that everybody, every youngster who wants to choose healthcare as a profession has to keep in mind: the need for the right people, the mindset to update themselves, upgrade themselves, upskill themselves is important. Second is choose to be a doctor for the right reason. Third is come into healthcare profession if you are very, very outcome oriented. That's my message to the youngsters today.
Okay. Okay. So your message is very helpful, and I think it would be, I think it would be understood by the youngster also. It's much clear and of course. Okay, so heading with the sixth question, sir. Sixth question. Sixth question. A glimpse into the future. Looking ahead, what transformative trends do you foresee shaping the Indian or global healthcare ecosystem in the next decade?
Uh, Abhinav, Rahul, both of you, I think there are a couple of trends which are going to impact healthcare immensely, and those changes we have already started to see happen. And this decade will be a redefining, decade for healthcare. One is
Okay.
gene editing. There's a lot of genomic studies that have happened. So if there is a genetic error or a change, a correction that is required in your body, that gene editing can save a lot of lives, specifically when it comes to diabetes, cancer, etc.
Yes, sir.
That will be very, very impactful. Second is AI in diagnostics. You know,
Yeah. Yes.
artificial intelligence in diagnostics, because if you see, diagnostics plays a very, very crucial role in healthcare. Whatever the doctor is doing with your body is based on what has been what has been diagnosed, or
Exactly.
the result of the tests that have happened. So the
Right.
improvement in diagnosis, thanks to AI, will be a redefining, thing that will happen within this decade. Then is regenerative medicine. When we are talking of lab grown uh, uh, organs, when you're talking of knee replacement, the lab grown knee, which is specifically personalized to your need, is going to be impactful. We've got artificial hearts now there. So,
Yes, yes, yes.
these lab grown organs will also create a lot of wonderful outcome when it comes to healthcare. Uh,
Yes.
the other thing that we have seen in diagnostics, in diabetes, is extremely important. I mean, we are talking about digital twins. So, there's a digital twin of yours that can be created, and we can figure out what will be the outcome of a certain treatment or a medicine, etc., on your twin. So that makes the treatment very predictive when given to you in actual. You know,
Okay.
so these are the couple of trends that I find are will be redefining healthcare in this decade.
In the coming future, you believe that. And
Absolutely.
okay.
I mean,
Yes.
you've already seen that happen. I mean, all these things is not something which is future. The work on all this is already happening. But advancement in these technologies will redefine healthcare completely.
All right. So, like, so it's like a personal question. Do you like believe that like AI is coming and it's growing very fast? So, in the healthcare sector, how can like it's apart from the diagnostic and all the machines, everything, how can the AI can help to predict the health of the person or the people in the country? How can like apart from the diagnostic can help the people in the
Every,
medical healthcare sector?
everything is data. In
Exactly.
when you are working on the computer side or when you're looking at social media, etc., there are always predictive analysis that are happening based on the data that is there and the trends
Yes,
that
sir.
we are seeing. कि outcome
Exactly.
क्या होने वाला अगले साल, 2 साल बाद, 3 साल बाद. Similarly, I mean, if you look at what does AI do, AI is working. There's a machine learning that is happening on the data which is available, right?
All
So
right.
it is creating predictability, right?
Okay.
So that is where it is making a difference. And second thing is that, we are all everybody who's working in the healthcare field is a human being, right?
Okay.
We have our own limitations. When you go to a doctor, uh, and they are using AI when diagnosing, whenever they are dealing with a patient or the diagnosis of a patient, the human errors or oversights can be reduced. That's a very
Right.
basic thing. You know,
Right. Right.
when
Right.
I'm looking at, if there is a doctor, hypothetically, when they're looking at a patient, when they're talking to them, the AI can actually tell you on the screen that, listen, have you checked for this?
Yeah,
Right?
basically a gentle reminder, and it can,
Reminder, or for that matter, something that a doctor might miss. I mean, I was yesterday was multiple sclerosis day, and one of the things that I learned when I was talking to a doctor is that even when somebody goes with the basic diagnosis to a doctor, the doctor may not be able to understand that it could be multiple sclerosis,
oh, right.
right?
Right.
So,
Right. Right.
so it is these things are making some very basic changes apart from the big technological advancement. These are very basic changes that are happening, that the doctor is told that, listen, these three parameters put together could be suggestive of this. Just be mindful, check for this, right?
It's
So
a very little thing, but it actually makes a difference, a huge
huge
difference.
difference. I mean, your treatment, your prognosis could be very,
Right.
very different if you were to just keep this in mind. So your
Correct.
is truly an assistant for a doctor or a diagnostics person.
Correct, sir. All right. Okay. So heading with the last question, sir. The a personal philosophy as a leader. What principle or belief anchors your journey? Something that keeps you grounded and driven amidst the demands of your work.
See, I tell you what, one thing that I've learned uh, through my experience of almost 3 decades is that always be a learner,
Yes.
be egoless,
Okay.
right? Because if you are egoist, you will not be a learner, right?
Correct.
And many
Right.
times, if you really want to be relevant to what you are doing in the industry that you are, you have to learn, and you could learn from people who are youngsters, who are looking at things differently. Their curiosity levels are very, very different. They are thinking of out of the box ways to do what you have been doing as a stereotype. So something
Right.
that I've learned, which has been my mantra now in the way I work, is that always believe that somebody who's somebody may have a better way to do it. Listen and learn from those around you. So which means
Okay.
open-minded,
Yeah.
open-mindedness and egolessness. These are my mantras. I mean, I consciously work on this.
And you try to learn from your youngster also. You see them and
Absolutely.
you can adapt
Absolutely.
something new from them.
There are a lot of things that I've done today which are right things, which I've learned from my young team members who are there.
Oh, that's something different. So I heard something different from you. Actually, I also apply it in my personal life also. Okay, sir. So this was the end of the podcast. Thank you so much, Mr. Harbinder sir, Narula sir, for
Thank you.
joining Mr. Russell Group.
Thank
And we are glad to have, and we will be, expecting you to come in the near future also to join something you will bring. And thank you again, Mr. Rahul Suri. Are you audible?
Yeah, absolutely.
Okay. So, sir, thank you so much for joining Russell Group also. We are very happy to see you. And we are also expecting you to come in the future also. So you can share some of your new ideas to us also, and the public and the societies also. So,
absolutely.
it can bring something new, innovative and change for the youngster. as well as for the older people also. So thank you so much, sir.
Thank you so
We'll
much.
see you.
It's a pleasure. Be a pleasure to join you anytime. And thanks for having me, or thanks for finding me worthy of your podcast. Thank you.
No, sir, it was about the time. Thank you so much, sir.
Thank you, Rahul. Thank you so much.
And welcome. Thank you so much for joining our organization.
It
We
is
are the podcast honored to have you.
it is
And
my pleasure, Rahul.
so kind of learning that you have given us. Those learnings are absolutely worth it for me, and then as absolutely worth it for Mr. Sharma. So thank you.
Thank you.
Thank you so much, sir. Bye bye, sir. Take care, sir.
Bye.
Have a great day.